Struggling with breastfeeding? You're not alone. One of the biggest challenges new moms face is getting the perfect latch. But don't worry. Today, I'm sharing 4 expert-approved latching techniques that will make breastfeeding pain-free, efficient, and comfortable. Whether you're a first-time mom or need some help improving your baby's latch, this video will guide you step by step. Let's get started. A proper latch isn't just about comfort. It's the key to successful breastfeeding. It prevents nipple pain and damage. No more cracking or soreness. It ensures proper milk transfer, so your baby gets enough milk. It boosts milk supply. Better stimulation means better production. It reduces gas and reflux. A good latch prevents air swallowing. So, how do we achieve the perfect latch? Let's go through the 4 best techniques. The deep latch method is one of the most effective ways to ensure a comfortable and efficient feed. Start with your baby's nose level with your nipple. Wait for a wide open mouth. Think big yawn. Bring your baby to the breast, not the breast to baby. Ensure baby takes in more of the bottom part of the areola than the top. If latching is painful, break the suction gently with a finger and try again. This gravity-assisted position helps babies self-latch in a more natural way. It encourages a deeper latch without forcing baby's head. It uses gravity to make feeding more comfortable for mom. It's ideal for newborns and moms recovering from birth. Try this position skin to skin to activate baby's natural feeding reflexes. This technique helps babies get more milk by improving nipple placement. Instead of centering the nipple, aim for baby's upper lip to touch first. Baby should take in more of the lower part of the areola. Lips should be flanged out, not tucked in. You should hear a soft sucking sound, not clicking, which indicates a bad latch. This method helps babies latch wider, especially if they tend to have shallow latch. Hold your nipple between thumb and index finger to point it slightly upward. Wait for baby's mouth to open wide. Think biggest yawn. Flip baby's upper lip up over the nipple as they latch. If baby's latch hurts, check that their chin is pressed against the breast and their nose is slightly free. Even experienced moms can face latching challenges. Here's how to fix the most common issues. If you have a painful latch, try repositioning baby for a deeper latch. If you hear clicking noises, check if baby's tongue is tied or if their lips are tucked in. If baby keeps falling asleep, use breast compressions to encourage active feeding. If you're experiencing ongoing pain, consult a lactation consultant for help. Breastfeeding doesn't have to be painful or frustrating. With the right latching techniques, it can be a beautiful and rewarding experience. Which latching technique worked best for you? Drop a comment below. If you found this helpful, hit that like button and subscribe for more breastfeeding tips. And check the description for my top lactation consultant recommendations and must-have breastfeeding gear.